All right, before we dive into this crazy story, do me a favor, subscribe and tell us where you're watching from. The emergency department at 12:58 a.m. Moved with a quiet, mechanical rhythm. Not calm. Not controlled. Just disciplined enough to hold together through fatigue. Fluorescent lights cast a flat glow over polished floors. The storm outside pressed rain against the ambulance bay glass in steady, unbroken lines. Inside, monitors pulsed, carts rolled, and voices stayed low. Elena Mercer stepped through the staff entrance without drawing attention. Her badge settled against her scrub top. New. Clean. The word temporary rotation printed beneath her name. No one looked up. No one needed to. She moved straight past the central station and into the supply corridor. A crash cart sat against the wall. Seal slightly loose. Not broken, but not right. Elena adjusted it. Checked the lock. Pressed it into place until it held. She didn't log it yet. She kept moving. Drawer by drawer. Gauze restocked. Syringes aligned. Medication trays corrected where labels had drifted out of order. Each chain small. Each one unnoticed. At the end of the corridor, an airway kit sat open on a prep table. Left that way from the previous shift. Elena stepped closer. Gloved hand steady. She checked the setup. Tube size. Blade alignment. Oxygen connection. Then paused. Just a fraction. The tubing angle was wrong. Subtle. Easy to miss. But under pressure, it would kink. Delay airflow. Cost seconds that wouldn't be available. Elena adjusted it. Not dramatically. Just enough. Tested the connection. Flow held. She reset the tray. Exactly as it should have been. When the respiratory tech returned a moment later, he glanced at it. Then moved on. No comment. No question. The correction absorbed into the system without a trace. At the nurse's station, a resident leaned back in his chair, watching her for a moment. That the new one? He asked. Another nurse nodded. Temporary trauma rotation. The resident smirked faintly. She looks like she'd apologized to the patient before starting compressions. A quiet laugh from someone nearby. Elena heard it. Didn't react. She stepped to the terminal. Opened the chart. Reviewed it once. Then again. A dosage entry. Small discrepancy. Not dangerous yet. But trending there. She corrected it. Updated the log. Closed the chart. No announcement. No correction call. The attending trauma surgeon entered the station. Conversation shifted immediately. Not stopped. Lowered. Because his presence changed the room. Dr. Holloway. Brilliant. Precise. And known for having no patience for hesitation. He scanned the board once. Then the staff. His gaze passed over Elena without stopping. Status? He asked. The charge nurse responded quickly. 2 pending discharges, 1 imaging hold, nothing critical. He nodded. Then glanced back. Not at her. At the setup behind her. The airway kit. He stepped closer. Checked it. Briefly. Then moved on. No comment. Which meant it met his standard. Elena turned back to the station. Hand steady. Movements efficient. Invisible. The resident leaned closer again. You're quiet, he said. Elena glanced at him briefly. Then back to the screen. Working, she said. He shrugged. Just saying. Trauma's not exactly a quiet job. No response. He smiled faintly. You might be better off in discharge. Less pressure. Another small laugh. Not cruel. Just dismissive. Elena absorbed it. The same way she absorbed everything else. Without resistance. Because resistance drew attention. And attention wasn't the goal. At the far end of the room, Dr. Holloway spoke again. If anything serious comes in, he said, not looking at anyone in particular, I want clean hands and clear heads. No hesitation. His eyes moved across the staff, briefly pausing on the resident. Then past Elena. Understood. A chorus of quiet confirmations. Elena said nothing, because he hadn't been speaking to her. Not really. The room settled again. Routine returning. Fatigue filling the spaces between tasks. Until the board changed. A tone. Sharp. Different. The charge nurse turned. Read it once. Then again. Her posture shifted. Trauma alert, she said. The words moved through the room instantly. Not loud, but immediate. Source. The resident asked. Military transport, she replied. That changed everything. The air tightened. Not visibly, but completely. Because military cases carried weight. Because they arrived fast. Because they came with expectations. Dr. Holloway stepped forward. Details. The charge nurse scanned the entry. Limited, she said. Inbound, high priority. No full report yet. A pause. Then, ETA 3 minutes. The room moved. Carts repositioned. Gloves pulled on. Monitors reset. The rhythm shifted from routine to readiness. Elena stepped into the trauma bay. Not at the center. At the edge. She checked the oxygen line. Adjusted the suction. Verified the airway set up again. Her movements were the same as before. Calm. Precise. Unnoticed. Behind her, the resident moved into position. Let's see what we've got, he said. Dr. Holloway stepped to the head of the bed. Command already assumed. The team aligned around him. Elena remained at the edge. Hands ready. Eye scanning. Because the difference between routine and something else was about to arrive. And the room didn't know yet which one it would be. The ambulance doors opened hard against the rain. Cold air pushed in. Then the gurney followed. Fast. Controlled. Not chaotic, but urgent in a way that carried weight. Male, mid-30s, the paramedic said as they rolled in. Severe blood loss. Field stabilized. Pressure dropping. The patient lay motionless except for the shallow rise of his chest. Oxygen mask in place. Bandaging across his torso. Dark with blood, but contained. Too contained. 2 men followed behind the gurney. Not medical. Not hospital. They didn't speak. Didn't assist. They just moved with it. Close enough to intervene. Far enough not to interfere. Their posture changed the room. Subtly. But completely. The kind of presence that made people stand straighter. Talk less. Think about what they were saying before they said it. Dr. Holloway stepped forward. Move, he said, already taking position at the head. The team adjusted instantly. The patient transferred to the bed. Monitors connected. Lines checked. Vitals pulled. BP unstable, the resident said. Dropping. Source: Holloway asked. The paramedic gestured toward the bandaged side. Penetrating trauma. Controlled in field. Controlled how? Limited info. That answer landed flat. Not helpful, but expected. The escorts remained silent. Watching. Always watching. Holloway didn't press them. He didn't need to. He had already made his decision. Focus on the wound, he said. We stabilize the bleed, we stabilize the patient. Simple. Direct. The room aligned around it. Because certainty moved faster than doubt. Elena stood at the edge of the bed. Hands already gloved. Eyes moving. Not following his hands. Following the patient. The breathing. Shallow. But not symmetrical. The rise and fall uneven. Subtle. Easy to miss. She looked at the bandage. Then the amount of visible blood. Then the monitor. The numbers didn't match. Too much loss. For what they were seeing. Ooh. Not enough visible loss. For what the body was doing. Her eyes moved to the fore. Field insertion. Clean. Efficient. Done by someone who knew what they were doing. Which meant the person who had stabilized him had seen more than what was obvious and had left something unspoken. Elena. The charge nurse's voice. She stepped forward. Prep fluids, the nurse said. Elena nodded. Moved immediately. Her hands worked without hesitation. Lines connected. Flow adjusted. Standard. Routine. Invisible. But her attention stayed split. Half on the task. Half on the pattern. Breathing. Pressure. Skin tone. Response. Not aligning. Holloway leaned over the wound. Clamp, he said. The instrument was already in his hand before the nurse passed it. He worked quickly, efficiently, confident, because this was his domain, because this was what he did. Stay with the obvious, he said to the resident. We fix what we see first. The resident nodded. Yes, doctor. Elena moved to the supplied tray. Pulled additional equipment. Not requested. Not announced. She placed it within reach. Extra tubing. Additional airway support. Backup line access. The kind of preparation that didn't belong to the current plan, but might belong to the next one. The resident noticed. Glanced at the tray. Then at her. What are you doing? He asked. Preparing, she said. For what? Elena didn't answer immediately. She adjusted the placement. Checked the connection. Then said, in case we need it. The resident shook his head slightly. We don't need it. Holloway didn't look up. We treat what's in front of us, he said. Not what might be. The words were directed at the room, but they landed on her. Elena nodded once. Step back. Hand still. No argument. No correction. The tray remained where she had placed it. Unacknowledged. Unwanted. For now. Behind her, one of the escorts shifted. Just slightly. His eyes moved from the surgeon to the patient, then briefly to Elena. A flicker of something. Recognition? No. Assessment. She didn't return it. Her attention stayed on the patient, because the pattern was becoming clearer. The breathing slowed. Not dramatically, but enough. The pressure dipped again. The monitor tone sharpened. Still dropping, the resident said. Holloway worked faster. More forceful now. Stay with me, he said. We control the bleed. We bring him back. Elena's eyes moved again. Chest. Not rising correctly. The timing off. The body compensating in the wrong direction. She had seen this before. Not here. Not in this setting. But somewhere else. Where the injury you saw was never the one that killed the patient. Her hands tightened slightly, then relaxed. She stepped half a pace closer. Not enough to interrupt. Just enough to be ready. The extra equipment sat within reach. Ignored. Until it wouldn't be. Holloway spoke again. Pressure, he said. Now. The nurse adjusted. The line responded. The monitor flickered. Not improving. Not yet. Elena didn't speak. Didn't challenge. She watched. Because she knew what came next. Because she had seen this exact collapse before. In a place where hesitation cost more than pride. And as the patient's numbers continued to fall, she waited. Not passively. Precisely. For the moment. When the room would realize. It had been treating the wrong problem all along. The room settled into a single idea. Not discussed. Not debated. Chosen. The visible wound. The bleeding they could see. The problem they could name. Dr. Holloway moved with certainty at the center of it. Stay focused, he said. We control this, everything else follows. The resident nodded. The nurses aligned. The rhythm of the room tightened around his voice. Because certainty was faster than doubt. Because it gave the illusion of control. Elena stood at the edge. Still. Watching. Not the surgeon's hands. Not the wound. The patient. Pulse pressure narrowing. Skin losing warmth in the wrong places. Breath depth shallow, but uneven. The monitor told one story. The body told another. She followed the mismatch. Layer by layer. The line responded to fluids. But not correctly. The color of the output didn't match the rate of loss. Too little visible bleed. For the way the pressure was collapsing. Her eyes moved to the chest again. The rise. The delay. The resistance hidden inside it. Not dramatic. But wrong. The room didn't see it. Because the room was committed. Because once a story was chosen, everything else bent around it. More pressure, the resident said. Give it, Holloway replied. The nurse adjusted. The monitor flickered, then dipped again. Elena moved. Quietly. She stepped closer to the supply line, adjusted the blood product position, reordered the sequence, not replacing what was being done, preparing for what would be needed next. Her hands were precise. No wasted motion. Extra line access within reach. Airway support repositioned. Backup ready. The kind of preparation that only mattered if the current plan failed. The resident noticed again. He glanced at her hands, then at the tray, then back at her. What are you doing? He asked. Elena didn't look up. Setting for continuity, she said. He frowned. That's not the priority. Holloway heard it. Looked up briefly. Followed the line of sight. Saw the adjustments. Then looked at her. Expression flat. Dismissive. You're not leading this, he said. Elena met his gaze for a fraction of a second. Then looked back down. I know. Then stop preparing for problems that aren't here. The words landed harder. Because they weren't just instruction. They were correction. Public. Clear. The resident gave a faint smile. She's just being careful, he said. Holloway didn't return it. She's being slow, he replied. Then, without looking at her, stay in your lane. The room absorbed it. No one challenged. Because hierarchy was intact. Because the story still held. Elena stepped back half a pace. Hand still. Position unchanged. The equipment remained where she had placed it. Unacknowledged. Unwanted. Necessary. Her attention returned fully to the patient. Pulse pressure narrowing further. Skin tone shifting. Breath becoming more shallow. But not from loss alone. From restriction. From something building inside. Her mind moved through it again. Confirming. Not guessing. She needed certainty. Not instinct. Because instinct would be dismissed. Certainty would still be resisted. But harder to ignore. Moral tension settled in. She could speak now. Interrupt. Challenge the path. Be removed from the bay. Lose influence completely. Or wait. One more beat. Let the pattern reveal itself fully. At the cost of time. At the cost of margin. She waited. One breath. Then another. Watching. Measuring. Confirming. The monitor dipped again. Harder this time. Pressure's dropping faster, the resident said. Holloway didn't hesitate. Push through it, he said. We're close. But they weren't. Elena saw it. Clear now. The pattern complete. The wrong problem had been chosen. The real one. Unaddressed. The patient's chest barely moved. The delay between inhale and response widened. The monitor tone sharpened. Then broke. Loss of stability, the anesthesiologist said. Now, Elena whispered. Too quiet to be heard. Too late to prevent it. The patient crashed. Not gradually. Not subtly. Exactly as she had seen it coming. Pressure collapsed. Breathing failed to compensate. The monitor spiked into alarm. The room froze. Just for a second. Because the story they had chosen had just failed in front of them. Holloway stepped forward immediately. What happened? He demanded. But the answer was already there. In the pattern. In the timing. In the silence that followed. Elena stepped forward. Not quickly. Not dramatically. Just into position. Because the moment she had waited for had arrived. And now, there was no room left for the wrong story. The crash fractured the room. Not into chaos. Into noise. Voices layered over each other. Commands overlapping. The clean rhythm that had held seconds ago collapsed into urgency without direction. Pressure gone. Support now. Stay with it. Dr. Holloway moved faster. More force. More certainty. Because speed felt like control. Continue the sequence, he said. Don't break focus. The resident followed. Hands moving. But the pattern no longer responded. The monitor shrieked. Flat tones cutting through the room. The patient's chest barely moved. Then, a flicker. Small. Almost missed. A shift in the patient's eyes. Not fully open, not aware, but not gone. The anesthesiologist leaned closer. Possible response, he said. Holloway didn't look. Stay on the plan. But the flicker grew. A breath. Ragged. Forced. The patient's head moved slightly. Not enough to regain control. Enough to break through the surface. Through shock. Through pain. Through the edge. His gaze didn't find the surgeon. Didn't follow the movement at the center. It moved. Past it. To the edge of the room. To where Elena stood. Still. Watching. Ready. His voice came through the mask. Rough. Strained. Barely formed. But clear. The word cut through everything. Not loud. But precise. The room froze. Not completely. But enough. Because the word didn't land like politeness. It landed like recognition. Like structure. Like something that belonged to a different system. The resident stopped. Just for a second. The nurse looked up. The anesthesiologist's hands paused mid-adjustment. Even Holloway hesitated. A fraction of a beat. Because the patient had chosen. Not randomly. Not instinctively. Specifically. Elena. Her expression didn't change. Not visibly. Her posture remained the same. Hands steady. Eyes on the patient. But internally, the shift registered. Immediate. Absolute. The past had entered the room. Without permission. Without warning. Without context. She didn't respond to the word. Not verbally. Not emotionally. Because responding would confirm it. Would anchor it. Would open something she had kept closed. Holloway recovered first. Stay focused, he said sharply. He's disoriented. The explanation was quick. Convenient. Dismissive. Because it protected the structure. Because it allowed the room to ignore what it had just heard. The resident nodded. Shock response, he said. But his eyes flicked once. Toward Elena. Then back. Uncertain now. The patient's gaze didn't move. Still fixed on her. Even as his breathing faltered again. Even as the monitor dipped. The word came softer this time. But no less deliberate. Holloway stepped forward. Blocking the line of sight. Stay with me, he said to the patient. Focus here. But the patient didn't follow. His attention remained where it had landed. Elena. She didn't step forward. Didn't acknowledge. But she moved. Small. Precise. Using the shift. The distraction. The moment when the room had fractured. Her hand adjusted the oxygen flow. Not increasing. Correcting. The angle. The timing. The kind of change that didn't draw attention, but altered the response. Then the line. She repositioned it. Slightly. Enough to improve flow. Not enough to be seen as intervention. Just maintenance. Just routine. But exact. The monitor responded. A fraction. Pressure stabilizing. Not rising. But no longer falling. Seconds. Bought. Quietly. The anesthesiologist noticed. Didn't speak. Just adjusted to match. The resident hesitated. Then followed the new rhythm. Without acknowledging where it came from. Holloway continued. Driving the original plan. But now, the room wasn't fully aligned. Because something had shifted. Because the patient had named it. Without explaining it, the word still hung in the air. Unanswered. Unresolved. But understood. Not by everyone, but by enough. The escorts at the back of the room had gone still. Watching. Not the surgeon. Not the procedure. Elena. Because they recognized it too. The tone. The address. The structure behind it. Elena kept her focus on the patient, because that was the only place it could stay. The only place it was allowed. The monitor steadied slightly. The breathing corrected. Just enough. The moment held. Fragile. Temporary. But real. Holloway spoke again. "Keep pressure," he said. But his voice had changed. Just slightly. Less absolute. More aware. Because the room had heard something. It couldn't unhear. And even without explanation, even without confirmation, the patient's single word had forced them to look again. At the one person they had chosen not to see. The room didn't fully recover from the word. It kept moving. But something had shifted underneath it. Unstable. Uncertain. Dr. Holloway forced the pace forward. "Stay on the wound," he said. "We correct the loss, everything follows." His voice carried more edge now. More force. Because control had been questioned. Even if no one said it out loud. Elena watched the patient. Not the surgeon. Not the instruments. The patient. Breathing still restricted. Pressure barely holding. The correction she had made. Buying seconds. Not solving the problem. She stepped forward. One pace. No sudden movement. No attempt to interrupt. Just enough to be heard. "It's not primary blood loss," she said. Her voice was quiet. Level. No urgency in it. Just clarity. Holloway didn't look at her. "Stay out of it," he replied. The dismissal was immediate. Automatic. Because acknowledging her meant acknowledging the disruption. Elena didn't raise her voice. Didn't repeat herself. She waited one beat. Then, "Pressure pattern doesn't match the visible loss," she said. "Respiration is restricted. It's not compensating." Now he looked. Directly at her. Irritation clear. "This is not your call," he said. The resident shifted. Uncomfortable. The anesthesiologist glanced at the monitor. Then back at the patient. The numbers didn't support the current path. Not fully. Not anymore. Holloway stepped closer. "You're seeing noise," he said. "Stick to your role." The words were sharper now. Not just correction. Containment. Because the room had heard her. Because the patient had seen her. Because control was no longer clean. Elena held his gaze. Only for a second. Then returned to the patient. "I'm describing what's happening," she said. Not arguing. Not challenging him personally. Just stating. The physiology. Nothing else. That was the difference. She didn't say she was right. She didn't say he was wrong. She said what the body was doing, and left the room to interpret it. The SEAL's eyes moved again. Slow. Heavy. But focused. Still on her. Not on the surgeon. Not on the voice commanding the room. On her. He forced another breath. Pain visible in the effort. Then, Quiet. Controlled. One line. She's right. The words were barely above a whisper, but they landed harder than anything else in the room. Because they came from the patient. Because they came from someone who had already chosen her once. Because they carried weight the room couldn't define, but couldn't ignore. The resident looked at Holloway, then at the monitor, then at Elena. The anesthesiologist adjusted slightly, not fully committing, but no longer aligned with the original rhythm. The room divided. Not openly, not spoken, but real. Half still following rank, half watching the evidence. Holloway's jaw tightened. He's disoriented, he said. The explanation came fast. Necessary. He's responding to whoever he can see. But his voice lacked something now. Certainty. Because the pattern wasn't holding. Because the body wasn't following his plan. Elena stepped closer. Not into his space. Into the gap. The place where the patient existed. Between decisions. If we continue this path, she said quietly, he won't compensate. Still no reference to herself. No claim of authority. Only consequence. Only outcome. The anesthesiologist spoke. Respiration is not supporting pressure, he said. She's not wrong. The shift deepened. Small. But enough. Holloway looked at him. Then back at the field. Then at Elena. For a moment, he hesitated. Just a fraction. But visible. And the room saw it. Elena felt it. The opening. The cost of stepping through it. Clear. If she pushed now, she would take the room. Not formally, but functionally. And once taken, it wouldn't go back. Not cleanly. Not quietly. Her past would follow. In pieces. In recognition. In questions. Or she could step back. Let the hierarchy hold. Let the plan continue. And risk losing him. The patient's breathing faltered again. Short. Insufficient. The monitor dipped. No time left for hesitation. Elena moved. Not dramatically. Not forcefully. She reached for the equipment she had already prepared. Adjusted it into place. Hand steady. Voice calm. We need to correct the restriction first, she said. Then support pressure. No emotion. No challenge. Just sequence. The anesthesiologist followed. Without asking. Because the logic was clear. Because the body was already proving it. Holloway didn't stop her. Not this time. But he didn't step aside either. He watched. Tense. Contained. Because the room was no longer fully his. The SEAL's gaze remained fixed on Elena. Even as his strength faded again. Because he had already made the decision. The room was still struggling to accept. And Elena, without raising her voice, without claiming control, stepped into the space where the wrong plan ended and the right one had to begin. The room held on the edge of collapse. Not falling. Not recovering. Suspended. The patient's pressure hovered just above loss. Breathing shallow. Uneven. Failing to support what the body needed. Elena watched the pattern complete itself. The restriction. The compensation failing. The narrowing margin. She had seen this window before. Not here. Not in a hospital. But in places where time didn't stretch. It disappeared. A salvage window. Short. Precise. Missed if you treated the wrong problem. For even a few seconds too long. The civilian rhythm would miss it. Because it relied on sequence. Because it trusted that time would hold. This wouldn't. Elena stepped closer. Not into command. Into alignment. We're inside a restriction window, she said. Her voice stayed calm. Flat. No urgency in tone. Only in timing. The words didn't sound familiar to the room. The resident frowned. What does that mean? Elena didn't look at him. It means pressure won't respond until we correct the underlying constraint, she said. If we push fluids now, we lose him. Holloway's expression hardened. That's not standard, he said. The resistance came immediately. Because the language wasn't his. Because the structure wasn't his. Because it didn't belong to the system he controlled. Elena didn't react. Didn't defend the origin. She adjusted the equipment in front of her. Hands moving with quiet certainty. This is timing, she said. Not preference. The anesthesiologist looked at the monitor again. Then at the patient. Then back at her. The pattern matched. Not textbook. But real. Holloway stepped forward. You're not running this, he said. Not loud. But sharp. Because the shift had gone too far. Because the room was starting to follow her without permission. Elena met his gaze. Only for a moment. I'm not, she said. Then, if this fails, it's on me. The words were simple. Clean. No defense. No argument. Just ownership. It landed differently. Because she wasn't asking. Because she wasn't challenging him directly. She was removing his risk. And placing it on herself. Holloway hesitated. A fraction. Because the room was watching. Because the patient was failing. Because the alternative, continuing the current path, was already proving wrong. Proceed, the anesthesiologist said quietly. Not a command. A shift. Enough. Elena moved. The sequence began. Not fast. Not rushed. Exact. She adjusted the airway support first. Not increasing flow. Correcting the restriction. Angle. Timing. Support at the right phase. Then, pressure. Not volume. Targeted. Measured. The kind of adjustment that only made sense. If you understood what was being constrained. Her hands didn't shake. Didn't hesitate. Each movement placed before the previous one had fully completed. One step ahead. Always. Because that was how you survived these windows. You didn't react. You anticipated. The room followed. Not fully. But enough. The anesthesiologist adjusted to match her timing. The nurse shifted the line. The resident watched. Then began assisting without instruction. Holloway stood still. Not stepping away. But not interrupting. Watching. Measuring. Because the pattern had changed. Because the patient was responding. Not dramatically, but differently. Elena's body stayed calm. But something else moved underneath. Old memory. Not visual. Not specific. Physical. The weight of similar moments. Different rooms. Different stakes. Same edge. Same timing. Same consequence if missed. Her breath remained steady. But her muscles remembered. The cost. The aftermath. The reason she had left that world. She pushed it down because it didn't belong here. Because this was about the patient. Nothing else. Hold here, she said quietly. The team held. No one questioned. Because the numbers were stabilizing. Not rising, but no longer falling. The monitor tone changed. Subtle, but clear. The patient's chest moved differently. Deeper. More aligned. The pressure responded. A fraction. Then another. Enough. Enough to confirm. The room exhaled. Not audibly, but collectively. Because the direction had changed. Because the edge had moved back. By seconds. Holloway stepped closer. Watched the response. Then looked at her. Not dismissive now. Not certain. Assessing. You've seen this before, he said. Not a question. Elena didn't answer. Because answering would open it. Would name something that didn't belong in this room. She adjusted the line again. Check the timing. Stay with this sequence, she said. Still calm. Still clinical. Nothing personal. The anesthesiologist nodded. The resident followed. The nurse adjusted. The room aligned. Not because she took control. Because the patient forced them to. Because the body had proven her right. The stabilization held. Fragile. Temporary. But real. Enough to move forward. Enough to survive the next step. And in that quiet shift, without announcement, without acknowledgement, the room's rhythm changed. Not owned by rank. Not driven by certainty. But by the one person who had seen the window before it closed and acted before it was gone. The room did not return to what it had been. It couldn't. Not after the shift. Not after the pattern had broken. Not after the patient had responded to someone the system had not chosen. The movement continued. Hands worked. Lines adjusted. Monitors tracked. But the alignment was different now. Eyes moved. Not just to the surgeon. To Elena. Quietly. Without comment. The resident adjusted a line. Then glanced at her. Not mocking now. Not dismissive. Trying to understand. The anesthesiologist watched the numbers. Then her hands. Matching her timing without asking. Even the nurse who had followed Holloway's lead earlier now waited half a second. Long enough to see if Elena would move first. The shift wasn't announced. It was felt. Dr. Holloway felt it. More than anyone. He stepped forward again. Closer to the field. Reasserting position. Maintain current sequence, he said. His voice steady. Controlled. But tighter. Because control now required effort. Because it was no longer assumed. He looked at Elena. Direct. You're operating outside protocol. The words were measured. Not loud. But deliberate. A reframing. If he couldn't dismiss her, he could redefine her. Make her competence sound like risk. Make the room question it. Elena didn't react. Her hands remained steady on the line. Adjusting. Monitoring. We're following the patient, she said. Nothing more. No defense. No justification. Just alignment with the only authority that mattered. The patient's chest rose. Held. Then fell. More evenly now. But not stable. Not yet. Holloway's jaw tightened. "That's not how this works," he said. The resident shifted, uncertain again, because the structure was trying to reassert itself, because doubt had been introduced, because people needed something to follow. Before Elena could respond, the doors opened. Not quickly, not dramatically, but with purpose. A hospital administrator stepped in, suit under a surgical cover. Eye scanning, taking in the scene. "Status?" he asked. The charge nurse answered. "Critical. Stabilizing." The administrator's gaze moved. First to the surgeon, then to Elena. Because the room had already marked her. Because attention had already shifted. "What's the issue?" he asked. Holloway spoke first. "Unconventional intervention," he said. "We're managing it." The phrasing was careful, neutral, but pointed. The administrator nodded slowly, watching, not intervening, because this was beyond policy now, because outcome would define everything. On the bed, the patient moved again, more conscious now, not fully, but enough. His eyes opened, focused, not searching, landing on Elena. Again, the pattern repeated, not random, not accidental. He didn't look at the surgeon, didn't follow the loudest voice. He looked at the one who had matched the problem. "What next?" he asked, his voice rough, controlled, directed. The question hung in the air, not because it was unusual, because of who he asked. The administrator noticed. The resident noticed. The room shifted again. Elena didn't step forward, didn't claim the moment. She answered from where she stood. "We maintain support," she said. "Then correct the next failure before it peaks." No explanation. No authority claimed. Just sequence. The anesthesiologist nodded. "Agreed," he said quietly. Holloway didn't respond immediately, because the answer was correct, because the room had heard it, because denying it now would cost more. Elena's eyes moved again, across the patient, beyond the immediate, looking for what came next. Because this wasn't over. Because patterns didn't stop at one failure. They layered. They evolved. Her gaze paused. Just a fraction. Then shifted. The skin tone. Slight change. Not global. Localized. The breathing. Still improved. But something underneath it was beginning to drift. Subtle, but familiar. Her mind moved ahead. Connecting. Calculating. There. A second complication. Not yet visible on the monitor, but forming. Waiting. She stepped half a pace closer. Adjusted the line again. "Watch his response curve," she said. The anesthesiologist leaned in. "Why?" Elena didn't answer directly. "Because it's about to change," she said. The words were calm, but precise. The room held for a second. Then, the monitor shifted. Not dramatically, but enough. The curve altered. The pattern began to break again. The anesthesiologist looked at her, then back at the screen. "Confirmed," he said. The resident's expression changed. Recognition. Not of her past. Of her accuracy. Holloway watched. Silent. Because this wasn't guesswork anymore. because she was ahead of the data. The administrator said nothing, but his attention stayed fixed. Moral tension settled again. Heavier now, because the room was watching, because every step she took revealed more. Elena could step back. Let the surgeon take over. Preserve what remained of anonymity. Ooh. Continue. Lead without claiming it. Expose more of what she knew, and lose the ability to stay invisible. The patient's numbers began to slip again. Faster this time. The window closing. Decision made itself. Elena moved. Hand steady. Voice calm. Prepare for correction, she said. No hesitation. No glance at the room. Because the patient came first. Always. Even now. With every eye on her. Even now. With the cost rising, she chose the patient. Again. And the room, whether it understood her or not, followed. The second drop came faster. Not gradual. Not forgiving. The monitor tone sharpened. Pressure dipped hard enough to strip away any illusion of control. The patient's breathing faltered. Again. But this time without the margin they had before. The window narrowed. Final. Unforgiving. The kind that didn't reopen if missed. Elena saw it immediately. Not as panic. As pattern. Everything aligning toward one outcome. Unless corrected now. Loss incoming, the anesthesiologist said. Holloway stepped forward. Hands moving. But slower now. Just a fraction. Because the case had moved beyond the model he trusted. Beyond what he could control with certainty. He reached. Paused. Adjusted. Then hesitated. Only for a second. But in this space, a second was everything. The room felt it. The break. The absence of direction. Elena stepped into it. Not forward. Not above. Into the gap. Support airway first, she said. Her voice didn't rise. Didn't push. It placed itself exactly where the next action needed to be. The anesthesiologist responded instantly. Adjusting. Because the timing matched. Hold pressure, she added. Not volume. The nurse shifted the line. Correcting. The resident moved without looking at Holloway. Because the sequence made sense. Because the body was already responding. Elena's hands moved. One step ahead. Always. She adjusted the angle again. Fine-tuned the support. Not reacting to the monitor. Anticipating it. Now stabilize the curve, she said. No explanation. No justification. Just the next step. The monitor dipped. Then held. Barely. But held. The room quieted. Not because it was calm. Because it was focused. Because every movement now followed a single rhythm. Not assigned. Not announced. Established. The patient's chest rose. Deeper. More aligned. The pressure responded. A fraction. Then another. Elena didn't pause. Didn't wait for confirmation. Maintain this timing, she said. Do not overcorrect. The anesthesiologist nodded. Understood. The resident adjusted his position. No longer watching Holloway. Watching her hands. Matching them. The nurse shifted the equipment. Already anticipating the next request. Because she could see it coming now. Holloway stood at the head. Still present. Still part of the field. but not driving it, not controlling it. Watching, because the room had moved, because the patient was responding, not to him, but to her sequence. Elena reached for the next adjustment, didn't look up, didn't check for permission, because permission would slow the timing, because timing was everything now. Prepare for correction, she said. The equipment was already in place, because she had prepared it earlier, because she had seen this coming before anyone else had named it. She guided the movement, step by step. No wasted motion, no repeated instruction. Each command placed exactly when it needed to be. The patient's numbers climbed. Not dramatically, not safely, but unmistakably. The curve reversed. The downward spiral broke. The turning point held. The room went still. Not physically, but internally, because something had shifted. Completely. Hierarchy hadn't been challenged. It had been replaced by reality, by outcome, by the simple fact that the patient was alive. Because of the sequence she had chosen, no one spoke. Because there was nothing to say. Because the result was already visible. The anesthesiologist adjusted once more, then looked at the monitor, then at Elena. Stabilizing, he said. Quiet. Certain. The resident exhaled. Slow. Controlled. The nurse stepped back half a pace. Not disengaging, just no longer needing to anticipate. Holloway remained still. Eyes on the field, then on her. Recognition, not of her past, of her control, of what had just happened. Elena didn't look at him, didn't acknowledge the shift. Her attention stayed on the patient, because the moment wasn't finished, because stability was fragile, because survival wasn't guaranteed yet. But the turning point had passed. The edge had moved back. The patient remained alive, because someone had stepped in when certainty failed, because someone had acted without needing to claim it. The SEAL's eyes opened again, more aware now, focused. He looked at her, held it for a moment. No words, none needed, because the outcome spoke, because the room had seen it. And in that quiet, in that stillness that followed, everyone understood what had just happened. The quiet nurse had taken the room without asking for it, and without ever needing to say she had. The room did not celebrate. It slowed, like something that had been held too tight for too long, and could no longer maintain the pressure. The monitor held its rhythm, fragile, but consistent. The patient remained alive, not stable, not safe, but no longer at the edge. Maintain current support, the anesthesiologist said quietly. No urgency now, just precision, the kind that followed survival. The SEAL's breathing stayed assisted, measured. His eyes closed again, not from loss, but from the body finally pulling back, from the edge it had been forced to hold. The charge nurse stepped forward. We're transferring, she said. The words were soft, because nothing about this moment needed volume. A transport team entered, controlled, efficient, no wasted motion. They moved the patient carefully, lines secured, airway maintained, monitoring transferred without disruption. Every step deliberate, because the margin still existed, just not where it had been. Elena stepped back, Not retreating. Making space. Her hand still. Her eyes following the movement. Tracking. Ensuring continuity. Not ownership. The stretcher locked into place. The team aligned around it. The seal was moved. Out of the bay. Toward the next stage. The doors closed behind them. And just like that, the center of the room was gone. The urgency left with it. What remained was silence. Not complete, but heavy. The kind that settles after something almost breaks. The resident leaned against the counter. Exhaled slowly. No words. Because there weren't any that fit. The anesthesiologist removed his gloves. Set them aside. Looked at the monitor that was no longer there. Then at Elena. Then away. Because acknowledgement would require explanation. An explanation wasn't available. Dr. Holloway stood at the head of the now empty bed. Hands still. Eyes fixed on a space that no longer held anything. He didn't move immediately. Didn't speak. Because the room had seen it. Every step. Every hesitation. Every moment where certainty had failed him. And someone else had filled the gap. He turned slightly. Looked at Elena. Not with anger. Not with dismissal. Something quieter. Heavier. Then he looked away. Because there was nothing to say. That would restore what had shifted. Elena didn't approach. Didn't offer anything. No explanation. No correction. No claim. Because the outcome had already spoken. Because anything more would change the nature of what had happened. The administrator stepped forward. Cleared his throat. Document everything, he said. Neutral. Controlled. A return to structure. Because structure was easier than truth. The room began to move again. Slowly. Tasks resumed. Charts updated. Equipment reset. But the energy remained different. Lower. Quieter. More aware. At the edge of the room, one of the escorts remained. He hadn't left with the transport. He stood still. Watching. Not the staff. Not the surgeon. Elena. He stepped forward. Not close enough to draw attention. Just enough. You've done this before, he said quietly. Not a question. Elena didn't respond. Her hands moved to the chart. Opening it. Reviewing. Routine. Invisible. The escort studied her for a moment longer. Then nodded. Small. Contained. Understood, he said. He turned. Left the room. No further acknowledgement. But enough had been said. Enough had been recognized. The room thinned. People drifted back to their roles. The noise returned in fragments. Not whole. Not yet. Elena stepped into the supply corridor. Alone. The door closed softly behind her. The silence here was different. Not shared. Not buffered. Just still. Her hand moved to the counter. Rested there. For a second. Then tightened. The control she had held all night began to shift. Not outwardly. Not visibly. But internally. The adrenaline that had kept everything steady started to drain, leaving something heavier behind. Memory. Not images. Not clear scenes. Just sensation. The same edge. The same timing. The same cost. Her breath stayed controlled, but it took effort now. Because the moment was over. Because there was no task left to anchor it. And underneath it, one word remained. Clear. Unavoidable. It echoed. Not in sound. In meaning. In recognition. In everything it implied. The life she had left. The structure she had buried. The identity she had chosen to disappear from. It wasn't gone. It had never been. It had just been waiting. Quiet. Like her. Until something forced it back into the open. Elena straightened. Slowly. Hand steady again. She stepped back into the corridor. Picked up a chart. Reviewed it. Because the work continued. Because it always did. But now, the room saw her differently. And she knew, even without a word spoken, that the past she had tried to leave behind had just found her again. Dawn didn't erase the night. It thinned it. The harsh edge of fluorescent light softened as grey morning filtered through the high windows. The storm had reduced to a steady drizzle, water trailing down the glass in quiet lines. The ER moved again. Not cleanly. Not fully reset. But functioning. The kind of motion that follows something the body hasn't finished processing yet. Monitors continued their rhythm. Carts rolled. Voices returned. Lower than before. Measured. As if the room had learned something it didn't know how to say. Elena stepped out of the supply corridor. Her badge clipped in place. Flat. Ordinary. The same as it had been at the start of the shift. At the nurse's station, conversation shifted as she approached. Not stopped. Adjusted. A resident who had laughed earlier now stepped aside slightly to give her space. No comment. Just awareness. The charge nurse handed her a chart. Room for needs a recheck, she said. The tone was neutral, but different. Less dismissive. More careful. Elena nodded. Okay. She took the chart. Moved down the hallway. The trauma bay she had stood in hours earlier was empty. Cleaned. Reset. No sign of what had happened. But the space held it. In the way people glanced at it without pausing. In the way no one spoke about it directly. Room 4. An elderly patient. Stable. Routine. Elena checked the line. Adjusted the flow. Reviewed the chart. Corrected a small timing error. Precise. Quiet. Unremarkable. Behind her, 2 nurses spoke in low voices. She knew exactly what she was doing. I've never seen that before. Where did she learn that? No answers. Because none had been given. Because she hadn't offered them. Elena finished the check. Documented it. Moved on. At the end of the corridor, Dr. Holloway stood alone. No team. No movement around him. Just stillness. He watched her approach, then stepped forward, not blocking her path. Just enough to be present. Elena. Her name. Not sharp. Not dismissive. She stopped. Looked at him. He held her gaze for a moment. Long enough to show the change. The absence of arrogance. The absence of volume. I was wrong, he said. Simple. Direct. No explanation. No defense. Just fact. Elena didn't respond immediately. Because the words didn't require anything from her. Because the night hadn't been about him. It wasn't about being right, she said. Her voice stayed calm. Level. The same as before. He nodded once, as if he understood, or was trying to. You saw it before anyone else, he said. Not praise. Recognition. Elena didn't accept it. Didn't reject it. She shifted the chart in her hands, preparing to move, because the conversation didn't need to continue, because the work still existed. Holloway stepped back, making space, not as authority, as acknowledgement. She passed him. The moment ended. Clean, unresolved, but complete. At the nurse's station, a message waited. Not written, not formal. The charge nurse looked up. Transport called, she said. Your patient stabilized in ICU. Elena nodded once. No visible reaction. The charge nurse hesitated. Also, someone left a note. She handed it over. Small. Folded. No name. Elena opened it. One line. Short. Controlled. You saw it before it happened. Thank you, them. No signature. None needed. She folded it again. Placed it in her pocket. No outward change. But the word remained. Clear. Unavoidable. Not praise. Not gratitude. Recognition. From a world she had left. And now, one that knew she was still there. At the far end of the hall, the administrator spoke quietly with another staff member. Policies. Reports. Containment. The system rebuilding itself. Trying to fit what happened into something it could explain. Elena moved past it. Uninvolved. Uninterested. Because none of that changed the outcome. Because none of that mattered to the patient. At the station, she set down the chart. Looked at the system. Then spoke. Flag protocols need adjustment, she said. The charge nurse looked up. What kind? Earlier visibility, Elena said. Less delay between recognition and action. Practical. Specific. Nothing about herself. Nothing about the night. The charge nurse nodded slowly. I'll pass it up. Elena didn't wait for confirmation. She picked up the next chart. Room 7. Routine again. She stepped into the room. Check before. Adjusted the line. Smoothed the blanket. The patient barely noticed. And that was the point. Outside, the hospital continued. The night fading. The story already beginning to shift into something smaller. Something easier to hold. But inside the room, Elena moved the same way she always had. Quiet. Precise. Invisible by choice. Her hand steady. Unchanged. Carrying everything they had done. Without needing anyone to see it. And as the morning settled fully over the hospital, she continued her work. Exactly where she belonged. Not at the center of the story, but inside it. Unseen. Essential. And already gone from view,